Good afternoon, ladies and gentlemen. Welcome to the first China-Nepal Anti-Cancer Summit. Warm greetings from Nepal, the birthplace of Buddha, Lumbini. At the outset, I would like to thank Professor Fan, the President of the China Anti-Cancer Association, CACA, and the Vice President, Professor Wang, for the great initiation of this Anti-Cancer Summit. I sincerely thank our respected moderators, Professor Li from China and Dr. Nepani from Nepal. Cancer is emerging as an important public health problem in Nepal. Access to cancer care remains a significant issue in Nepal, particularly due to limited infrastructure and inadequate awareness. Today I am going to explain access to cancer care in Nepal, current challenges, and propose potential solutions. Nepal is a small, lower middle income country between two giants, China and India. Its population is approximately 30 million in an area of 147,516 square kilometers. Nepal is a landlocked country with three geographic regions: Tarai, 23% in the south, hills 42%, and Himalayan mountains 35% in the north. There are 7 provinces, 77 districts, and 753 municipalities in Nepal. Our literacy rate is 77%, and the GDP per capita is 1336 USD. The life expectancy is 72 years, and the birth rate is 2 children per woman. This slide is quite busy, but it is informative. Nepal has a unique healthcare delivery system. We have a hybrid healthcare system where the public and private sectors provide health services, mainly allopathic medicine. However, Ayurvedic, homeopathic, acupuncture, and other traditional medicines are also available in Nepal. In both public and private setups, there are 4 tiers of health care deliveries at community, local, provincial, and federal or central levels. There are also some specialized hospitals like trauma, eye, tuberculosis, cancer centers, etc. Nepal lacks a robust population-based cancer registry. Recent data indicate an increasing cancer burden in Nepal, with incidence rates rising steadily over the years. Overall cancer incidence and mortality rates are 82 and 55 per 100,000 persons respectively. According to Globocant 2022, the leading cancer in Nepal is lung cancer, which is 11% of all cancers, and then breast, cervix, stomach, colorectal, gallbladder, oral, thyroid, leukemia, and ovary. Comprehensive cancer centers provide many cancer control components. WHO recommends that all nations have a cancer control plan that includes prevention, early detection and screening, diagnosis, treatment of new cancer cases, follow-up, care of survivors, palliative care, and end-of-life care. Without essential services to reduce cancer risk, morbidity, and mortality, individuals may face higher cancer incidence, poorer quality of life, or suboptimal outcomes. According to WHO, access to cancer care is recognized as a fundamental human right. Timely access to cancer care saves lives in the short terms and prevents future complications. In lower middle income countries, it may also prevent the medical migration of oncologists to high income countries. Nepal's 7 provinces are diverse in geography, religion, socioculture, economy, and ethnicity. Most public and private health infrastructures, including cancer centers, are concentrated in Bagmati province, the central region. Cancer screening and diagnostic facilities are available in all 3rd and 4th tier hospitals, including medical colleges and diagnostic centers in urban areas. However, community-based screening remains rare in Nepal. Regarding the treatment option available in Nepal, surgery is well developed with more than 50 trained oncosurgeons and some system-specific surgeons working in central level hospitals and cancer centers. Radiotherapy services are relatively new, starting with Telecovalt in Nepal in 1991. Currently, Nepal has 11 centers, 5 public and 6 private radiotherapy machines with 28 radiation oncologists and 16 physicists. According to the WHO recommendation, we need 19 more radiotherapy machines in Nepal for 30 million population. Medical oncology, solid cancers, hemato-oncology, blood cancer, and pediatric oncology, childhood cancer services are relatively new and increasing in Nepal. These services are available at the central level and in cancer hospitals with 20 experts in medical oncology, 10 in hemato-oncology, 40 in pediatric oncology. There are 10 palliative care physicians working in cancer hospitals or palliative care centers, hospices in Nepal. Access to cancer care is the biggest challenge in Nepal. It has multiple associated issues like limited healthcare infrastructure and resources, geographical barriers, and rural-urban divide. One of the major factors is the socio-economic factor. Many people cannot afford the treatment cost for cancer. Cultural and societal barriers are there across the country. Lack of cancer awareness is a major issue in Nepal. Many people still consider cancer to be a death sentence, not a curable disease. Ensuring a consistent quality of cancer care is very crucial. High quality cancer care is based on the research data available in the country. The complexity of cancer care and the diversity of the treatment options for an individual cancer patient will make evidence-based management more challenging. There is an urgent need of national cancer management guidelines in Nepal. The majority of cancer patients present to the hospital in late stage, they need palliative care. Pertinent symptoms like pain, nausea, vomiting, breathing difficulties, etc. are addressed. Providing comprehensive care during the terminal phase of cancer should encompass the patients and their family members. Even after the patient demise, extending care to the family remains an integral aspect of cancer palliative care. Undergraduate and postgraduate education trainings are conducted by different medical institutions under Tribhuvan University, NAMS, BPKHS, Kathmandu University, and BPKMCH. We have different cancer-related courses like MD Radiation Oncology, DM Medical Oncology, Radiotherapy Technology, Fellowship in Oncosurgery, and Oncology Nursing. Technologies and innovation like artificial intelligence, telepath, robotic surgery are helping accelerate progress against cancer. What once seemed impossible in cancer research is now a reality. Several technological innovations like electronic medical record, online cancer registry, multidisciplinary tumor board, webinars, and journals reports have led to breakthrough in finding, visualizing, understanding, and treating cancers. Now let's discuss the strategy for improving access to cancer in Nepal. Number one, strengthening healthcare infrastructures and facilities. Number two, expanding cancer screening and diagnostic services. Number three, implementing community-based outreach programs. Number four, enhancing affordability through financial assistance program. Number five, improving healthcare workforce capacity and training. Number six, increasing public awareness and educational initiatives. According to the recently launched National Cancer Control Plan, the allocation of funds and resources to establish cancer centers in all 7 provinces had been initiated. A robust population-based cancer registry is to be started. Integration of cancer care into primary healthcare services by initiating a lay model. There should be a strong collaboration between the government, NGOs, and international agencies like WHO for sustainable cancer control in Nepal. There are various tobacco control measures implemented by Nepal that include banning smoking in public places, government offices, and public transportation. We must regularly adjust tax rates in line with inflation and income growth to reduce the affordability of tobacco products in Nepal. On the other hand, we must promote green vegetables and fruits to prevent non-communicable diseases including cancer in Nepal. The Ministry of Health and Population has recently been expanding cancer services to all 7 provinces in Nepal. Our next priority would be the nationwide population-based cancer registry. Additionally, some private hospitals are offering cancer services, including radiotherapy in regions outside the central areas. The sustainability of these interventions is critical for cancer care services throughout Nepal. We have to introduce basic oncology courses in medical colleges and general practice curricula. In conclusion, there is an increasing burden of cancer in Nepal. Access to cancer care is biggest challenge in Nepal. There are multiple associated issues with it, particularly limited infrastructures, financial constraints, and inadequate awareness. The next step should focus on achieving the long-term goals of improving access to cancer care and implementing sustainable intervention in all 7 provinces of Nepal. Thank you.